One of the things that I think a lot of people struggle with is they have lingering symptoms post-operatively. So they've had excision surgery and they have lingering symptoms, whether that's constipation, food sensitivity, it might be bloating is another one of those things. Is it concern for you?
I will say that those symptoms are common after bowel surgery. So when let's say someone has diverticulitis or colon cancer or rectal cancer, whenever we cut the bowel and put the two ends back together, bloating, discomfort, constipation, diarrhea, those are common symptoms to have after surgery for about 2 to 3 months, up to 6 months. Now, I will say after 6 months after a colectomy, the symptoms that you have are sort of your new pattern. So I tell patients all the time, I'm like, not sure you're going to have a bowel movement like you had in your 20s, but after 6 months, you'll be predictable. So that kind of education is important to have up front so that they understand that's part of the healing process.
Like Vince said, like, you don't want to pathologize everything post-operatively, right? Like sometimes it's just a healing process. The question is like, does it make sense, right? Like, did they remove the TI, the terminal ileum, and now acid mouth diarrhea? Like that makes sense to me, right? If you have a colectomy and you have diarrhea, like, all right, like you lost your rectum. If there's rectal sparing surgeries and whatnot, but like does a surgery and what happened pair with what you're experiencing, right? You can develop certainly like SIBO post-operatively, right? Is it adhesions? Is it the narcotics to take post-operative? So there's things that exist certainly outside of mast cell activation syndrome. So you take the person, the surgical intervention, and what their symptoms are, and you try to combine all three. I have had patients with mast cell whose symptoms were attributed to endometriosis. They had endometriosis, surgery was performed, and they felt no better because it was just mast cell, right? But you have to do that. You are required to look for those things because endometriosis can affect so many things, fertility, right? And so you want to do your due diligence when there's something you can intervene and fix. Can you kind of create a nice story with what's happening? If you can't, and there's food intolerances and brain fog after surgery, like that's not related to the surgery, right? That's something different. And so you just have to understand the surgery, understand what the symptoms are, and how to kind of connect the dots.